On a Saturday morning in June of 2009, a 55-year-old woman named Elizabeth and her husband Ron pulled their RV into a campsite in western Vermont. Elizabeth loved camping and took every chance she could to head for the wild, leaving behind her comfortable suburban life in Connecticut. But as she had gotten older, she had begun to enjoy the comfort of an RV. It was much nicer to sleep in a warm bed at night and not have to deal with the hassle of setting up a tent and then sleeping on the ground. The RV lifestyle was just so simple and so easy. Today, all the couple had to do was park their RV at the campsite, then put on some sunscreen, and then head out for their hike. And so, that's what they did. The dense Vermont forest they were in was beautiful, but Elizabeth had to admit that the conditions today were kind of miserable. The whole area was buzzing with these black flies that were swarming all over Elizabeth's legs and neck, and of course, Elizabeth had forgotten any bug spray. By the time she and Ron had got back to camp, every exposed part of her body was covered in bites, and over the next few hours, those bites turned into welts. Usually, whenever they went camping, Elizabeth and Ron really enjoyed lighting a campfire up at night and sitting out under the stars. But that evening, the black flies were so bad that they just stayed in the camper and played cards. Elizabeth and Ron were in good spirits though. They'd camped in less than ideal conditions before, from freezing cold to pouring rain, and so they weren't about to let a few bug bites ruin their trip. But by the time Elizabeth changed for bed that night, her arms and legs were an unsightly mess. They didn't hurt, but all the red, swollen welts looked terrible. So she took a few ibuprofen to help with the swelling, and then she climbed into bed. The following day, Elizabeth and Ron got up and packed their bags and they headed home. And even though they had not enjoyed the black flies, they had had an overall nice time and felt energized from their weekend in the fresh mountain air. But for the rest of the week that they were home, Elizabeth battled this terrible on-again, off-again headache, and the welts from all those black fly bites were not going away. Elizabeth spent the following weekend at her niece's house in Long Island, New York. She was excited to catch up and spend some quality time with her family. But the whole time she was there, Elizabeth felt groggy, like she needed a strong cup of coffee. And then when she left and began driving back home, her headache came back full force to the point where it was just this constant, horrible throbbing pain against her temples. When she finally got home, she immediately took some ibuprofen to help with her headache, and then she drank as much water as her stomach would allow. She knew that black fly bites were not toxic, but her body seemed to be taking longer than usual to recover from them. That night, Elizabeth went to sleep early, hoping she'd wake up feeling better. But she didn't. She woke up in a cold sweat, and her stomach churned and her head pounded. She knew right away that she had a fever. Her husband Ron grabbed a thermometer from the bathroom, and sure enough, when he took her temperature, it was 101 degrees Fahrenheit. At this point, Elizabeth was really starting to worry. She'd been sick now for more than a week, and she really didn't know how much longer this was going to last. And next weekend, she and Ron were hoping to go camping again in Vermont. They were going to meet up with Elizabeth's cousin and her cousin's husband. Elizabeth was really looking forward to the trip, but she was worried that her sickness, whatever it was, would force them to cancel. All week, Elizabeth tried to take care of herself. She stayed in bed, drank a lot of water, and ate well to help her body overcome this sickness. And finally, the morning before they were supposed to leave for Vermont, her fever broke. Throughout the day, she got better, and by that evening, she felt well enough to go camping. She was thrilled. For the first time in a week, Elizabeth got a good night's sleep, and the next morning, June 22nd, she and Ron loaded up the RV and headed back to Vermont. When Elizabeth and Ron arrived at the Winhull Brook camping ground, it was absolutely downpouring, which made it difficult to find their campsite and hook up their RV, but luckily, Elizabeth's cousin was already there and could help them get set up. When Elizabeth's cousin made a joke about the great weather they were having, Elizabeth thought about her last camping trip in Vermont and decided that she actually preferred this monsoon over swarms of black flies. Elizabeth invited her cousin and her cousin's husband into their RV, planning to cook some dinner while they waited for the rain to subside. But several hours later, the rain still had not let up, and so Elizabeth's cousin and her husband ran back to their own RV, and Elizabeth and Ron, they climbed into bed and they went to sleep, hoping that when they got up, the weather would clear and they could actually go outside and enjoy the outdoors. But the next morning, when Elizabeth woke up, the rain was not remotely on her mind. Instead, she had this blinding headache, and she also knew immediately that her fever was back. Her skin was itching and her eyes felt red. Her mouth felt gritty, almost like it was covered in little bumps. Elizabeth was annoyed, knowing she was likely going to be sick all day and could not participate in anything they were going to do. Elizabeth rubbed her eyes and slowly made her way to the bathroom to brush her teeth. She debated whether she should just ask Ron to take her home, or if she could tough it out in the RV so he could at least still enjoy the vacation. Once in the bathroom, Elizabeth spit out the toothpaste into the sink, and she noticed her spit was bright pink. And when she rinsed her mouth, she tasted blood. She opened her mouth and stuck her tongue out, and her eyes widened as she realized the bumps that she had felt inside of her mouth were these black blood blisters all along her tongue and on the inside of her cheek. Elizabeth started to feel panic rising in her chest, and so she hurried out of the bathroom and over to her cousin's RV. Luckily, her cousin's husband was actually a doctor, and so he had Elizabeth stand in their kitchenette while he looked around the inside of her mouth with a flashlight. And after a minute, he turned off the light and just shook his head. He said he had never seen a condition like this before, and he urged her to go to the hospital. Within minutes, the RV was packed up and Ron was sitting behind the wheel. Elizabeth needed to use the bathroom before they headed off, but when she urinated, it burned. Now Elizabeth was truly worried. These were not flu symptoms. Elizabeth made her way to the passenger seat up front, sitting beside Ron. By this time, her headache was back and worse than ever. She popped an ibuprofen as they pulled out of the campground, but nothing took the edge off the pain in her head or the itching that had developed all over her body. It took 2 hours of driving down winding country roads to get to the nearest emergency room in Brattleboro, Vermont. To Elizabeth, every single time they hit a bump in the road, it made her nauseous with pain. By the time they arrived, Elizabeth was in pure agony. Ron parked the RV, then walked around to the passenger door to help Elizabeth get out. When she saw him, she smiled at him, but she could see his eyes were full of fear. It wasn't until she herself looked in the rearview mirror and saw her reflection that she understood why. Her face was so swollen that she almost didn't recognize herself. About 5 hours later, Dr. Teresa Fitzharris walked into her office at Brattleboro Memorial Hospital, ready to start her overnight shift. She put her purse under her desk, then went to check on Elizabeth, who was her first patient of the night. When Dr. Fitzharris walked into Elizabeth's hospital room and looked at Elizabeth, the doctor tried to hide her shock. Elizabeth's throat, chest, torso, and entire back were covered in a bumpy red rash. Dr. Fitzharris played it cool, but she'd never seen a rash this bad before. Elizabeth also had a fever of 101.6. Her heartbeat was also elevated, and her eyes were so swollen she could barely see out of them. Dr. Fitzharris sat down next to Elizabeth, and then Elizabeth began to recount the last 2 weeks of sickness and misery and all the symptoms she'd experienced since getting bit by all those black flies. Dr. Fitzharris pulled 2 rubber gloves out of a cardboard box in the storage cupboard. She put them on, then gently ran her hand down Elizabeth's arms and back. And as she did this, she frowned. She was confident that this was actually not the result of black fly bites. But Dr. Fitzharris couldn't think of any other condition that would cause a rash like this. And until she could figure it out, Elizabeth was very likely to continue to get worse. At a minimum, the rash could cause serious, lasting damage to Elizabeth's skin. Her eyes could be damaged as well, and there was no telling what this mystery condition could be doing to the inside of Elizabeth's body. Dr. Fitzharris didn't really know where to start with Elizabeth, so she just ordered some x-rays and blood work, and then went to go check on a few other patients while she waited for those things to happen. A little over an hour later, after Elizabeth had gotten the x-ray and done the blood work, Dr. Fitzharris looked over the results on the computer in her office, and to her surprise, Elizabeth's blood work and her x-rays had come back totally normal, and so Dr. Fitzharris was stumped. So she picked up the phone and called one of her colleagues, Dr. David Albright, the infectious disease doctor who was on call that night. She walked Dr. Albright through Elizabeth's symptoms, and she could hear him scribbling notes down as she spoke. And then after Dr. Fitzharris was done talking, Dr. Albright let out a long sigh. He said that most sudden fevers, like the one Elizabeth had, were caused by viral or bacterial infections, and so the problem now was figuring out which one of those she'd contracted. Because Elizabeth had been spending so much time outdoors, Dr. Albright guessed that she might have an insect-borne illness like Lyme disease or Rocky Mountain spotted fever. Dr. Albright told Dr. Fitzharris that he'd be in the next morning, and he promised to make Elizabeth his first stop. In the meantime, Dr. Fitzharris decided to put Elizabeth on antibiotics just in case she did have an insect-borne illness. If left untreated, conditions like Lyme disease or ehrlichiosis can cause organ failure. The doctor just hoped that she hadn't acted too late. Early the following morning, Elizabeth woke up to the sound of a knock at the door of her hospital room. She squinted through her swollen red eyes and saw the blurry outline of a person walking into the room. He then introduced himself as Dr. Albright and asked if the medicine that Dr. Fitzharris had prescribed was helping at all. Elizabeth groaned and shook her head no. She told Dr. Albright that she could barely see and her rash was more painful than ever, to the point where even a tiny shift in bed was extremely painful. He promised he would do everything he could to help her, and then he said he was very sorry, but he needed Elizabeth right now to sit up straight so he could determine how much her rash had spread. And so Elizabeth tried not to scream as Dr. Albright helped her sit up. Even the slightest touch on her skin was agonizing. As Dr. Albright looked over Elizabeth's body, he could see that the rash had spread, and it did not look like the medicine had helped at all. That meant his suspicion that it might be something like Lyme disease was incorrect. But unfortunately, he didn't really have any idea what else could be making her sick. Elizabeth clenched her teeth as Dr. Albright helped her lie back down. She knew the doctors were doing their best, but the fact that basically nothing had worked so far was still extremely frustrating. She could barely open her eyes and her whole body felt like it was on fire. About an hour later, Dr. Albright reappeared in Elizabeth's doorway. This time, Elizabeth could make out a second figure standing next to Dr. Albright. Dr. Albright explained that he'd brought a colleague with him who was a dermatologist or a skin doctor, and his name was Dr. Jorge Crespo. Dr. Albright wanted Dr. Crespo to take a closer look at Elizabeth's rash. He hoped that if they could determine what kind of reaction this was, it might inform them what was actually making her sick. Elizabeth braced herself for pain as the doctors once again helped her sit up so Dr. Crespo could look at her. He spent a few moments examining Elizabeth's rash, checking her eyes and the inside of her mouth. Then Elizabeth saw him nod to Dr. Albright, as if to confirm a suspicion. He told Elizabeth that she had a rare but severe kind of allergic reaction called Stevens-Johnson syndrome. Dr. Crespo explained that she'd ingested something that triggered an incredibly violent response from her immune system. Her body was so desperate to get the allergen out of her system, it attacked the deepest layers of her skin, causing the blistering rash that now covered her whole body. Soon, he believed, the top layer of her skin would start peeling off. It would look worse before it felt better, almost like she'd suffered a severe burn. None of what the doctor was saying made any sense to Elizabeth. She assured Dr. Crespo that she hadn't ingested anything unusual over the past 2 weeks. She told him again about the black fly bites and wondered if maybe any of the flies could have been carrying some kind of bacteria or virus or fungus that could have infected her. But Dr. Crespo just shook his head no. What made Stevens-Johnson syndrome very unique was not only the reaction, but the thing that caused it: medicine. For reasons doctors do not fully understand, medicines that normally improve people's health can sometimes trigger this life-threatening allergic reaction in certain patients. In Elizabeth's case, Dr. Crespo was confident that the cause was one of the most common, easy-to-get, over-the-counter medicines on the entire planet: ibuprofen. Elizabeth's jaw dropped. She'd been taking ibuprofen steadily for the last 2 weeks to reduce the swelling from all the black fly bites and to alleviate her headaches. Little did she know, the medicine was causing all of these problems. But something didn't make sense to her. She told Dr. Crespo that she'd been taking ibuprofen for as long as she could remember. If she was allergic to it, then why hadn't this happened before? Why didn't she have a big reaction the first time she took it? Dr. Crespo shrugged. He admitted that he really didn't know why Elizabeth would develop this allergic reaction so late in life. Stevens-Johnson syndrome was so rare that the root cause of it was actually still unknown. But at least Elizabeth knew now that she could not take ibuprofen, and Dr. Crespo assured her that if she stopped taking it, that she would recover in about a week or maybe 2. Elizabeth was given steroids to help reduce her symptoms, and a few weeks later, she had recovered enough to go home, just like Dr. Crespo promised. But because her allergic reaction had gone untreated for 2 weeks, some lasting damage had already been done. Elizabeth's eyes had swelled so badly that her tear ducts were permanently damaged and no longer worked. Ever since, she's had to administer saline drops in her eyes every few minutes to keep them working properly. But Elizabeth likes to look on the bright side and has said at least she can still see.